I just want to say that I'm really happy everyone's here. I don't love public speaking, but I love educating people. So my intentions are good, but my nerves don't really reflect that. So if anyone has any questions or wants me to slow down at any point, just let me know. Who was at my low back pain seminar before? Just Tracy? Okay. So we've revamped it a little bit, trying to simplify it for everyone so that with the goal of everyone going home with one or two things they didn't know. Who here has low back pain or has had low back pain?
So like everyone.
Nice. Okay, perfect. Who here works out? Okay, great. So we'll be doing a lot of fun stuff. You can learn a bit about your low back pain. You can learn how to be safe in the gym and how to do cool things like deadlifting and squatting without hurting yourself more. Yeah, so this is pretty exciting. Raf and I have worked beside each other for the past year and a half, and we've created a healthcare model that well, I guess I should tell you I'm a chiropractor, and so I focus on the treating, the diagnosing, and the assessing, and I work with Raf as a movement coach on getting people moving safer, teaching them how to move their bodies in ways that they didn't know how to before, and how to be safe in the gym especially. So it's a really good duo, and it's been really good for especially people with low back pain. So. Okay, so just a little bit about my background and why I'm so passionate about this topic. I had low back pain in my early teens when I was playing hockey. I went and saw a chiropractor for about 3 to 6 months. He adjusted me, it hurt, and I never felt better. It wasn't until grad school where I learned about the anatomy of the body, the anatomy and physiology of strength and conditioning, that I was able to apply these tools to myself, and this is when I started being able to do cool stuff in the gym like deadlifting, deadlift competition, deadlifted 200 pounds, no pain. I still play hockey, I do CrossFit. So I'm lifting weight, I'm feeling good. I have my own flare-ups of back pain, but they're much less frequent, and I kind of know my triggers. I know when I've done kind of the wrong thing. So if anyone has issues with sitting today, feel free to stand up, sit down, it's okay, like I understand. So yeah, okay, so the first thing I want to go over is some of the most common myths with low back pain. So the first one is low back pain is due to tight hamstrings. Now this is actually, hamstring symptoms are typically a result of low back pain. So for example, if your low back's irritated, it can put pressure on your sciatic nerve. And the sciatic nerve, as you can see in this picture, goes right down the back of the leg where the hamstrings are. Sometimes your symptoms can be sciatic nerve related when you think they're hamstring. So you stretch your hamstrings out and you're actually irritating your sciatic nerve more. And this isn't the case for everyone, but sometimes this is why the pain gets worse with hamstring stretching. So getting it looked at to make sure, is it your hamstring, is it your sciatic nerve, figuring out what the trigger is. Next myth is laying in bed is good for my low back pain, which is usually what your physician tells you to do. In fact, this causes low back pain. Every night you go to sleep for 7-8 hours, your disc between your vertebrae fill up with water and they swell a little bit. This is typically why people get stiffness or soreness in the morning, because the swollen disc, which is good, we want more water in the disc, but it can sometimes put pressure on the nerve, put pressure on the disc, and it feels a little bit irritating till we kind of get up and moving and everything kind of settles in. So if you lay down when your back's hurting, the disc will continue to swell, causing more pressure on possibly irritated structures. Myth, daily gym workouts will get rid of my low back pain. Well, that's not always the case. You have to find the right workout for you, the right movements, and that sometimes takes a little bit of time to figure out what that is. If I have low back pain, I should do yoga and Pilates. This is often also prescribed by physicians. If we go back to our sciatic nerve example, where stretching the hamstrings may irritate your low back pain, yoga has a lot of stretching, and that might be, stretching tissues that shouldn't be. So again, knowing what you can and can't do versus just following a general guideline that you see online. Stronger muscles will cure my low back pain. Now, this can be true, but it really depends. Again, going back to the other examples, knowing exactly what you need to be doing. Sometimes when we go into the gym, we have a tendency to do the things we're good at, so the things we're strong at, and we avoid the things we're weak at. And that could be where we get a lot of imbalances in our muscles. Like, for example, when my back really hurt, I avoided all back exercises, so I had a really, really weak back, and that is not good. Your back needs to be strong, otherwise it won't be able to be strong under pressure, right? There are low back stretches that will reduce pain. So you go online, your back's hurting, let's find some stretches. Stretch it out, right? So the most common one is child's pose, getting down on the ground, feeling a good stretch through the muscles of the back. Now, right away, the back will feel a little bit better. You've stretched, the nerves have a positive input, but what if your disc is irritated? And that is one of the irritating factors, is bending forward. So there are no low back pain stretches unless they've been identified by you and your doctor to figure out, is that a direction that you should be moving in? And if it's not, should you be avoiding it? The last one is having a powerful back is protective. So think CrossFit. If I'm doing box jumps for speed, should I be loading those box jumps for speed? No. The higher power force on the spine, the higher risk of injury. So deadlifting, we want to be doing it, if we're doing it heavy, we want to be doing it slow. Box jumps, if we're doing them fast, we need to be doing them unweighted. They can't go together and be amplified. So some simple low back pain facts. 4 to 5 adults will have low back pain in their lifetime, like an acute episode, and 30% of those will lead to chronic pain. It's the 5th most common visit to physicians. And just a note on imaging findings. Oftentimes x-rays, MRIs will give us a diagnosis, but this doesn't always correlate to pain. So for example, if in a lot of studies they've done on people with low back pain or without low back pain, they'll do an MRI, they'll do an x-ray, and they'll see degeneration or disc bulges, and everyone has it, whether they have symptoms or not. So if someone comes in with their x-ray findings saying, oh, I have degeneration, that's why I have low back pain, well, the person next to them that doesn't have low back pain may also have the same x-ray findings, and this has been shown in the research. So it's really important when patients come to see me that I ask them, what have you been told about your low back pain? What are your beliefs about it? What is the imaging said? And figuring out, is this really correlating to the back pain? Because it usually doesn't. So just understanding that it's sometimes a bit more simple than just an x-ray finding. Okay, so where to start? It's really quite easy, and there's a lot of things you can do for yourself. So the first thing that I usually get people to do is identify what things hurt your back. So what things make your back feel worse? Identify all the things in your day that you do where your back doesn't feel good, and then identifying the things that make you feel good or that don't hurt. So that's like a very simple place to start. So if you guys can kind of think about that throughout the presentation, I think that'd be really good for you. So the most common causes of injury are repetitive trauma and sustained trauma. So an example of repetitive trauma would be if you, so let's say a trainer at the gym, they have to set up the workouts all the time. They have to be bending over, picking up weights. If they're constantly bending over with a flexed low back, that is going to be a repetitive trauma to their back over time. Now, the low back has a tolerance of how much trauma it can take before it becomes injured. So if you're constantly doing that threat to the low back, then it's going to eventually lead to the straw that broke the camel's back and give out, right? The tissues can no longer sustain that threat. The next one would be sustained trauma. So that would be a sitting job or something that requires you to do something for a long period of time, like standing. Again, the tissue only has a certain amount, a certain level it can take of the threat until it collapses. This might be a little bit confusing, but I think it's important to understand. When you have either the repetitive or the sustained threat to the body and it reaches that threshold, it sends an input to the brain that says, like, this is a threat, we can't handle this anymore, and the brain sends pain down to that area so that you don't injure it. So sends pain down to the back, and it increases the sensitivity of the back so that the back no longer can go into that position so that you don't hurt yourself. That tissue sensitivity makes the next threat even greater because it doesn't want you to keep doing that to the body. So a good example is if I were to hit my thumb with a hammer every hour and just keep doing that every hour, hit my thumb with a hammer. Next time after a certain amount of time, if I brush my thumb, it's just going to hurt really bad. But brushing my thumb isn't really a threatful thing, right? So same thing kind of goes with the back over time. Does that make sense? It's the most confusing part. So people stay in pain because of these bad habits, these continuous threats on the body. If I keep hitting myself with the hammer, I'm going to continue to be in pain. So the most common way people have pain is with bending forward. They're putting a lot of stress on the low back. So I'm going to use this primarily as the example. If you have other situations, feel free to talk to me at the end and we can figure out if your situation's different. So if I have pain with bending forward and I sit all day in a bad posture, or I bend forward with my low back all the time, or I go to the gym at the end of the day and I do sit-ups, which flex my back even more, that is going to be a bad habit that I'm constantly doing to my back. So what can you do? Change the bad habits. I know it seems really simple, but sometimes it can be this simple and it can make a huge difference. So if I remove the trigger, so if I don't sit with that bad posture, or I get up and I move around so that I can keep the good posture, if I bend with my hips, like shown in the example. So the hip hinge is a primal movement where you're either using the hips or you're using the low back. If you use the low back, then you're creating a threat to the body. If you use the hips, then you're not creating a threat to the body. Learning the proper foundational patterns like we're going to today is another way to avoid that threat, and building a strong core to create a good solid base around the spine. So here's a good example, especially for the low back, where Raf and I always target people's hips first, learning how to move with the hips and not the low back. It seems silly that we would move with our low backs if they hurt, but some people just don't know how to use their hips. So in the example of the girl bending forward, the second picture, she's clearly rounding through her low back, and you can see her legs and her hips stay pretty straight. But in the third picture, you can see she has a clear 90-degree angle of her hip joint, and her back is straight. Now that is how we can limit putting load on our low back, and we'll learn how to do that today. Same thing goes with the squat. Learning your squat depth, and at what point are you using your low back or your hips will determine, are you threatening the body when you squat, or are you helping the body when you squat? Seems really simple, but I mean, it kind of is. We just have to learn how to do it. Okay, so here's a good example of changing your pattern. So if I go to work and I bend forward with my hips and I don't use my back, I put $1 in my low back piggy bank. If I decide that I'm going to sit all day and I'm not going to get up, my back gets tired and I'm putting stress on it, I take $1 out of my piggy bank. This goes on for the whole day. At the end of the day, if I have $20 left in my piggy bank, that is where I can use it in the gym. So I can load my back, I can get stronger. But if I have negative money in the piggy bank like most of us do, and I come into the gym and I do those bad habits like sit-ups, a bad deadlift, that's when you're going to injure yourself. So then here's going back to those charts. If I bend forward poorly, that's a threat on the back. If I hip hinge, that's not a threat on the back. So that's where I get my flat line. I get a little bit of rest. Now look at my tissue tolerance at the end of the day. Much better than before. So again, just to kind of summarize, we want to break the pain cycle with good habits. We want to exercise the right way and not be damaging ourselves when we're in the gym. And we want to build a resilient back through strengthening. Oh, that didn't turn out. And then one of the best resources I have for people, just because all of you obviously are pretty ambitious and outgoing to figure out what's going on with your back, The Back Mechanic by Stu McGill is awesome. Read it, memorize it. It has everything you need to know about your pain and how to deal with it. Reach out to me Raf and I, again, help you find the things that you need to do or don't do in your day. Treatment helps with eliminating that threat to the body, and then proper movement helps you build that safe movement pattern. Does that make sense? Any questions?
What about sitting? Not just surrounding that, but how should you be sitting?
So if you think about at the start of the day, everyone wants to sit down really well, right? But you can only hold, like you only have so much endurance to sit for an amount of time. Same goes for anything else. If I bend forward or if I deadlift for a certain amount of time, I only have so much endurance to hold that. So if you're sitting on a exercise ball and then you're getting up every hour, or you're sitting on a chair getting up every hour, that will kind of give yourself a break from that activity. It's sustained sitting that you don't even realize leads to the bad posture, right? You can only hold yourself upright for so long. It's just movement variability, right? Sitting's not bad for you, but you can't sit all day. Our bodies aren't meant to do that. Okay, Raf, do you want to jump in?
So before I get started, just to get like a sense of the room, who here has deadlifted with a barbell? Okay, almost everybody. And out of all of you deadlifting with the barbell, any of you experience low back pain doing it, or like something just doesn't feel right, or maybe you just don't get it? Okay, so a lot of time. Okay, so this will be really good. So maybe in the hands-on portion, we might just go right into the barbell deadlift, because I find a lot of times when people go to gyms, they see people deadlifting and they're like, oh, okay, I guess I'll do it too, and it just doesn't feel right. And a lot of times when we're seeing the Aura members come to the clinic, and I usually just ask them like, what hurts in the class? Like deadlifts. I'm like, okay, well, let's see your deadlift, and it's usually not anywhere close what it should be. And it's like switching like one or two different things, and out of nowhere they're like, this feels a lot better. And I'm like, yeah, that's all you got to do. Sometimes people kind of get worried that it's one of those exercises that it's going to make things worse, but it's actually the reverse. It's like, it's a really good exercise to kind of bulletproof your body. And I always kind of use that terminology with clients, where I want to make you bulletproof so that when you go pick up your kid, you're not out of commission for a week and you have to call into work saying that you hurt your back picking up your kid. But anyway, I'm going off topic. We're going to get into this thing. So Rafal Matuszewski, that is my name if you don't know who I am. I have a unique kind of placement in this gym where I work for Aura as one of the coaches, an educator, and also doing all the social media. And then also I work for Restore, where I've partnered up with Sarah, where we've kind of been bridging the gap, because a lot of times when I've been training clients, someone gets injured, I'm like, yep, you should go see physio or chiro. They go, and then they get an exercise like clamshells and bird dogs, and they do it wrong at home, or they can't even remember what it is, and they don't really get better, and they don't know if they should go back to the gym just yet. And maybe the physio or chiro doesn't really understand exercise, and they just think like every trainer throws people into burpees and like running on the treadmill until you're crying, but that's not true. There's some good coaches out there. So when Sarah and I met, we decided that we need to kind of bridge that gap and get people better faster. So that's what I do with Restore, along with their social media as well. And then this is a selfish plug. I have my own podcast called Cut the Shit, Get Fit, where I interview a lot of coaches that I look up to every week and get their thoughts on nutrition, fat loss, strength, powerlifting, whatever, sometimes Netflix series if we have time, but great resources if you are into podcasts. So the title of my presentation is How to Deadlift and Squat Without Effing Up Your Shit, because a lot of people should be squatting and deadlifting, but at the same time, they don't really know what they're doing. And I've seen some really fit individuals in this gym hurt themselves back squatting and deadlifting. And when you ask them certain questions, they have no clue what I'm talking about. So it's great to, and get that going. So you'll see a lot of this kind of stuff online, and people think this is okay. And you're just like, no. So one of the coaches that I follow, he has something called a shit test. So if something smells like shit, looks like shit, most likely it's shit. So anytime you're in a gym and you look at an exercise and you're just like, yeah, I don't know if that's right, you're most likely right that it's wrong. And a lot of people do this over and over again. They end up like this guy, where they have to like drink water over a tap with a hurt back, and it's super embarrassing. So you're probably asking yourself, like, what should I do? So step one, anytime you're in pain, like, don't try to, like, go on Google, like, how do I fix my back pain? Like, go see a chiropractor like Sarah. She doesn't do this, but, like, I'm a huge fan of The Simpsons, and, like, this is how I do my presentations. Like, before even putting information together, I look at GIFs and images and then see if I could plug it into a presentation. So a lot of this stuff is going to pop up throughout this whole thing. And the second kind of portion, when you kind of figure out what's going on with your body, when you see a chiro or physio, is to get a movement assessment. And that's where I come into play. So anytime I get a new client, I want to see how they move. And I use something called the functional movement screen, where it kind of places your body in positions where it's supposed to capture pain. And if I capture pain in those movements, that's, again, I'll refer out to Sarah to be like, hey, this person in their overhead squat had pain in their right hip. See if you can figure that out. But that doesn't mean that you shouldn't work out. There's just some things that we need to address first before we, load the pattern. Then the next step, that's Sarah assessing me. Anyway, step 3, there's always prerequisites. I always use this word for clients where if you want to be able to deadlift, you have to meet a certain criteria. So I kind of make the example where, you're in university and you want to get your 4-year degree. So rather than going into like intro to psychology 101, you take the highest level course, you're sitting in there, you're like, what the hell's going on? And you fail the course. So you want to have certain prereqs in order to be able to deadlift pain-free. And one of the tests I sometimes do is getting people to touch their toes. And a lot of people can't do that. And there's more to it, but essentially it's like, if you can't touch your toes, what gives you the right to go all the way down into a deadlift position and lift weight off the ground if you even can't get there? There's more to it, but that's just a small little example I like to give to people to make them, understand what's going on. So I have kind of like a check mark list of what you need in order to deadlift. So the first one is having enough core strength, right? So things like doing front planks, side planks, anti-rotation exercises are great to build that core strength, not only in the front, but like when I say core, like I'm talking about this whole area. And a lot of people waste their time doing crunches that don't really give that bang for your buck. And when you go into something, advanced like a deadlift, those crunches that you've been doing over and over again are not going to cut it like this cat, right? It's just, this is how people usually look when they do crunches anyway. So it's like, focusing on more functional core stuff that will build a resilient body so that when you do grab a barbell, you don't kind of collapse forward. So the next thing too is having enough T-spine mobility. So your thoracic spine up here, in order to actually deadlift, you need to be able to extend. And a lot of people who sit all day at a desk are like here all the time. And I always tell this to clients, like, again, sitting's not bad like Sarah said, but the average person, they sit while driving to work for 45 minutes. They sit at a desk 8 to 10 hours every day. Then they go back into their car to drive another 45 minutes. So now they're eating dinner sitting. Now they're sitting on their couch watching Netflix for the rest of the night. Do that 5 days a week. 3 decades go by and you're like this, and now you want to go deadlift. So a good example of someone having bad mobility is like Drake when he got into deadlifting and working out. He just can't extend through his T-spine. So that's what usually happens. So now if you layer on top poor core, bad T-spine mobility, that's how deadlifts usually look. The next one is actually engaging the lats. So with T-spine mobility, if you have enough of it, you're able to engage these guys here. But a lot of times also people think they're engaging their lats by like, I'm going to squeeze my shoulder blades back. But that doesn't really get this entire section of your lats to actually engage in order to extend up properly in the deadlift. And then the last thing is having full hip extension while having your glutes engaged. So a lot of times when, again, that average person that sits all the time, when I get them into the gym, they can't extend their hips all the way. So when I get them to do glute bridges, they kind of get stuck to a certain spot, and then they can't get these guys going. So they'll usually feel hamstrings or like low back. So now we got to figure out a way to give more hip extension in order for them to deadlift. And like one of the things I like giving them in the beginning is glute bridges, but finding a way to you know, get those glutes activated and then eventually progress into like something like a hip thrust. And I have this rule when people do glute bridges or any kind of hip thrust is not to look me in the eye like this guy, because it's super creepy as you're thrusting your hips forward. So that's like gym etiquette 101. Don't look at someone directly in the eye when you do hip thrusts. So if I had to create like a progression of where I start with clients, I kind of go through this. So if someone was brand new and does not understand the difference between hinging their hips or squatting forward, I want them to practice learning how to do this over and over and over and over again until it's just like ingrained into their head that, you know, when they go to pick something off the ground, they're not going to do some weird thing to lift it up. They're going to just automatically go boom and then pick something off the ground. From there, that's where I would go actually learn how to like lift something off the ground. But it's really interesting, like talking to Sarah about this week when we were prepping for this presentation. It's like, even when I coach clients deadlifts and they do it perfect, like we'll finish our fourth set of 10 reps, their deadlift looks spot on, perfect, and then they go over to the water fountain and they're just like this. And I'm like, what are you doing? Like, we just practiced this. So it's like, now that gives me information of like what they do every day. Because a lot of times in the clinic, we'll see people come in with complain about low back pain. It's like, what did you do? I picked up my sock. Like, that's a heavy ass sock that you just picked up. But it's because of that bad habit. It's just, you know, in my head, I'm like, if I can teach someone this constantly, then maybe when they go pick something up, they'll kind of have that in their head and they can go grab it without hurting themselves. So with the deadlift, what I kind of want to do today is maybe just start at the barbell so people can feel a little bit more confident. But again, a lot of times people feel like they have to do the barbell, but sometimes like your body might not be designed to deadlift properly, and we just need to find something else. Because a lot of times, we'll get into the presentation later, like everyone has different hips. Everyone has different stuff going on, and maybe we just have to elevate it. Maybe we have to turn your toes out. Maybe we got to put your feet closer together. It's just finding what works for you. So maybe what we can do is actually move the chairs out of the way. We'll do a small warm-up because I don't want people going into you know, something cold like this. So let's slide the chairs out of the way and do our thing. What I do with clients all the time is something called CAR. So this is an abbreviation for controlled articular rotations, which is a fancy way of saying we're going to move our joints the way we're designed. So a lot of times when we see patients, this is what I give them. And it looks kind of dinky, whatever, but when you start moving the joints the way they're supposed to, you tend to feel better, right? So we're sending like synovial fluid, blood flow, nutrients to that joint, and I kind of describe it as like we're flossing our joints. So in the beginning, it sucks, your gums are bleeding, but down the line, if you keep flossing, your teeth will improve. Same with our joints. We're going to build the integrity of our joints, and then from there, we can add some more complex movements. So we're going to kind of work our way up all the way down the line from each joint. Before we start, does anybody have any injuries I should know about? All right, what do we got? Okay. All right, so this is where CARs go super important. So you never want to go through pain, you want to go around it. So the way I describe it is we're drawing a perfect circle with our joint. Say you're going and you hit tightness, maybe even pain, go around it. So I want you to create a buffer zone. So here's an example. I have a client right now, super shitty shoulder, and this is a shoulder CAR. Best case scenario is that's how it's going to look. For him, it's this. That's pain-free. And that's what I want, because what we're doing is we're promoting a response back to the brain that this is a safe pattern to do. If you're constantly going through pain and it feels like garbage, your brain's going to remember that and tell you to F off and make things worse. So don't go through pain. Everything should be pain-free. If it's tight, that's okay, but create a buffer zone. So we're going to start with our necks. All we're going to do nice and slowly. Again, speed's not your friend, so go slow. Neck is going to come down nice and slow. We're going to go to the left and make a big circle around to the right. Come back down, and then we're going to freeze in the middle and come back the same way we came. So we're going to do 3 rotations there and back, nice and slow, and try not to move anything else other than your neck. And then when you're done, you can awkwardly look at me, and I'll give you the next one. Yeah. Or you can do the creepy eyes like the guy hip thrusting. So the next one we're going to do are shoulder blades. So the next one, you're going to have your hands on your pants the entire time. So I want you to think of sliding your hands into your front pockets while bringing those shoulders forward. Then from here, you're going to slide your shoulders up towards your ears. Now you're going to bring your hands towards your back pockets and bring those shoulder blades together, and they're going to slide down. Then we're going to reverse the same thing, nice and slow. So yeah, so you don't want to bend the elbows. You want to keep them locked out, keeping the hands on the pants. So we're going to go there and back for 3, nice and slow. And again, if there's pain, create a buffer. Don't go through it, go around it. Crunching's fine. Means something's working. So after 3, what we're going to do is our thoracic spine. This one takes a little practice, and a lot of people don't really get it. So watch me before you start doing it. You're going to cross your arms in half just like this. And what we're trying to focus on is bending from the top here and not our low back. Because a lot of times when people do T-spine cars, they try to do this. But what I want to see is this. And what we're going to do from here is we're going to slide to the left, extend back, rotate around to the right, come back down to the center, and then reverse right back. So we're drawing a giant circle once again with our spine. And something that can help is if you squeeze your bum to lock this out, because a lot of times people kind of hinge at the hips and they might get into this position. So remember, just the upper portion of your spine. Give it a try. If you're lucky, you might get a few cracks too. And we're nice and slow. Don't go through pain. And breathe. All right, I feel like we've done 3. Everyone's just, they're still going. So what we're going to do is shoulders next. What I want is your left hand to go on your right hip, and this is going to give you feedback if you start rotating your whole hip and torso. So watch me first before you go. You're going to have your right hand out, thumb straight, and from there you're going to reach up as high as possible until you hit that first roadblock of tightness. From there you're going to start rotating the wrist and thumb, then elbow, then shoulder coming all the way down, and now my thumb is behind me. Now we're going to reverse the motion nice and slow and rotate right back to where we first started. What I don't want to see is this. And I've seen it, and people think they're doing it right. So try to suck the shoulder down and try not to use your neck or hip or anything funky like that. So let's give it a try, 3 per side. Nice and slow. As you're going, the one thing I want you to remember is a lot of times when people get out here, this is where it's tough. They'll just kind of drop really quick. So when you get to those tight spots, slow it down even further. That's going to give more feedback to the body of what's going on. Again, there is a learning curve to it, and a lot of times I'd explain it like if I gave you a whole dance routine to learn and you had to do it fast, it'd look pretty ugly. But if you slowed down every single movement, your brain would have enough time to understand what you're trying to get at, and then it's going to look clean and perfect. Have we done 3 per side?
Yep.
Okay. So for those who are done, next thing we're going to do is hip cars. So ideally, if you can grab like something like this, the squat racks, so you can be in a single leg stance. You can also use the wall that we have in the back. We would just have to move the benches, but something just solid that you're not going to fall over on. So we have like a lot of pillars over here if people want to hold on to them. Just make sure you can see me. So what we're going to do for hip cars, we're going to go right hand holding on to something and left hip working. So what we're going to do, your left hand is going to be on your rib cage so you have room for that leg to move. So what we're going to do is you're slowly going to drive the knee up as high as possible. You're going to drive the leg out to the side, rotate the hip, and now this knee is going to continue around drawing a circle so that knee meets the other knee, and then from there we're going to reverse, open up, and drive the heel and come back down. We're going to do 3 per side. Again, this one does take some time to, get things going. Sometimes it's going to feel awkward, but the slower you go, the better it is. When in doubt, just think of drawing a big circle with your hip. What I don't want to see is when you get to those tough parts, you're rotating your whole body. There is a chance that your hamstring might cramp if you're trying to extend so far back and you don't have good control of your glute. Your hamstring will kind of take over and it'll feel like it's, betraying your body, but that's okay. So again, 3 per side, and then we'll get this going. So yeah, grab a dowel, and I'm going to explain what we're going to do, and I'm going to come around, and Sarah can do the same thing. And this is a quick assessment that I stole from Dr. John Russin, and which I thought was super brilliant. If we're running out of dowels, we have more, don't worry. We got a couple more there too. So this next one, so Sarah and I will kind of split everyone up. What we're going to do, because we've all kind of played around with the barbell deadlifts, this is what I do with clients to kind of find their depth, is we're going to hold on to the dowel and we're going to pretend like it's our barbell. And we're going to slowly go down into a deadlift. And what we're going to do is we're going to come around, put our hands on your low back. And what we're going to do is my fingers are going to be together, and the moment they spread apart, I'm going to tell you to stop. And that's going to be where your deadlift depth should be. So it's a really easy way to figure out if you are, going too far, too low, whatever it may be. And then you can kind of have like a mental note of like, okay, I'm supposed to stop right before my knee bone. I'm supposed to stop right after where my patella is. And then when you're in the gym, you can actually elevate your deadlift where you're supposed to go. Does that make sense? Okay. So Sarah left me, so I'm going to try to do as many as possible. I'm coming. Right about there. So just memorize that small line. Did you want me to do it again? Come back up again and do it again. Nice and slow. About there. Yeah. Same thing. I got you. So whenever you're ready. Right about there. Memorize that line. So come back this way. So nice and slow, and try to keep the dowel sliding down on your, right about there. Yeah, I'm coming. So come back up. So you're kind of getting into that squat. I want you to see more of a hinge. Almost like think of bowing forward. That's better. All right, so come back up and we'll do the same thing. Right about there. Yeah. But again, like this can change because when we actually place a barbell, you might be able to go a little bit lower whenever you're ready. About there. Yeah. Yeah, so memorize that imaginary line. Before we get started, a couple things that I always see that people do as a mistake with the deadlift is when they get to it, they're way too far back. So what I see a lot of times is, barbells in front of them, and they're like this. So now when you deadlift, the fulcrum of the whole movement becomes your low back. The moment you slide it in towards your shins, now the majority of the weight's going to go through your hamstrings and glutes, and that kind of bulletproofs that whole idea of, I'm not going to F my shit up when I lift this thing. So with that in mind, that also goes down to one of those points that I made to get lat activation. Really hard to get lat activation over here, but when you pull it down this way, that's how you get your lats engaged. So let's try, who wants to go first, and we'll go one by one. All right. So what we can do, what I usually get people to do, does take some time, but we're going to do it anyway. So we're going to put a couple 45s. All right, so get towards it, even closer. There you go. So if you look at like powerlifters that are really, really good at what they do, they are super close to the bar to the point where you're going to feel like you're going to scrape your shins. So a lot of times when people get over that fear that they're not going to scrape their shins, the thing that happens is on their way back down, they'll start doing this. They'll kind of want to miss their knees. And again, now we're getting back into like, oh, I feel my low back and not my hamstrings and glutes. So it takes a lot of practice to kind of get over that fear. But let's reach down and just set up and don't pull just yet. How does that feel so far?
Good.
Yeah.
Tight.
Yeah, so if you feel hamstrings just kind of like giving you feedback, that's okay. But like already her position looks so much better. And if we had it on the floor, something would have already have compensated. It's usually like this is what happens. So to get into a good position to actually lift it, a lot of people make the mistake of, all right, this is heavy, I'm going to yank. Whereas I want you to think of pulling it in, breaking the bar in half to get those lats engaged, and then thinking of like old school leg press machine where you're trying to push the weight away from you, but your whole body is stiff. So when I get clients deadlifting, I tell them I want you to squeeze the crap out of that bar like you want to break it. So same thing for you. I want you to squeeze it super tight and nice and slow, just drive it up, and we'll see what we got after that first rep. Yep, all the way up, and then back down nice and slow. Yeah, so that wasn't too bad. So the next kind of layer, how did it feel?
Good.
Okay, so the next kind of layer I get people to do is now that we have, you know, the distance pretty close, we're squeezing tight, we're breaking the bar, is now I want feet placement. So what I get people to think of is first you're putting your heel in, big toe in, and then the rest of the toes. So now we're kind of like a tripod into the ground. We're rooted and we're not going to move anywhere, and now we have our arch kind of activating. And then the next layer after that, what I get people to do is thinking of pushing their feet out this way. So the moment you do that, you feel this turn on. A lot of times this is another way to create that tension, because a lot of times when I see people deadlift, they kind of lose it at one point. Like they'll get super tight, and as they come up, they kind of lose it. So as much as possible, if we can create more tension in our deadlifts, then you kind of bulletproof yourself again not to mess things up. So for this next one, squeeze, break in half, feet are rooted into the ground, and as you're coming up, you're pushing your feet out this way. And breathe. And then back up. And then back down. Perfect. So like that looked amazing. Like, you know, if she was my client, I'd be like, awesome. And we'll practice this. And like, again, it's not heavy, but the form is perfect. And I want people to get really comfortable with that. And then maybe 3 weeks, 4 weeks, 5 weeks from now, add another set of 10s on there. And then as this gets easier and easier, we're building that weight up. And most likely, if you continue training and your body's moving better, let's now drop 145 on. Let's get less weight and then build up from there. It's a constant like build up, recover, build up, recover. Does that feel good? Awesome. Who's next? Awesome. Were you guys about the same imaginary line?
Yeah, and then I thought Annie and I would, because we end up sharing bars anyway.
Okay, fair enough. So before you go, I want this to be tight. Yeah, there you go. Squeeze super tight. And good. So what for you, like what I see a lot too is if you guys didn't see it, she kind of likes to keep her toes up. And like this is a thing that I've seen for years where people want to like, I need to feel my hamstrings. So like going onto your heels, yeah, you're going to feel your hamstrings. But as the weight gets heavier, I see a lot of times people losing balance if they're putting like everything back here. And then over time, it becomes a bad habit. And sure, you can see some progression, but over time, you're going to hit a plateau. So now you have to retrain this bad habit and kind of go back to square one. So it's always good to, you know, this is why I like training general population from like brand new, is teaching them those good habits. So then when they want to get strong, it's automatic, it's quick. So just like we said before, I want you to think heel, toe, the rest of the toes, and then keep it tight. And also on the way down, try to keep it tight towards you and try not to lift it over. So already you can move further forward with your legs. Get tight up here. Squeeze the bar like you want to break it. And then don't be scared to come all the way up. Yeah, so a lot of times people will forget to do that and they kind of stay in that hunched over position, and that again brings more tension onto that low back.
That's a great thing.
Yeah, maybe. But again, there's more to it. And if I was being really picky, so come back down, like there's something going on here that she can't get that last little like extension. Like, I don't know, what do you see?
Yeah, so
Is my low back not supposed to be on?
it's not necessarily. I'm not really seeing a lot.
It's not in pain.
low
Like,
back.
it feels great.
It's just like I'm being picky and I'd rather see it a little bit more neutral. So if I saw that with a client and like we've already elevated it, I would go, you know what, let's try sumo deadlift. Because then now that's going to make you a little bit more upright.
Yeah.
So for a sumo deadlift, I want you to go wider with your toes out a little bit. And then when you reach down, I want your arms to go inside the knees. And a lot of people, when they get into that position, they kind of want to do this. But again, if you want full glute activation and extension, you want to push your knees out and keep that position where the knee's kind of right over the ankle, and squeeze super tight, bending the bar, and then driving it up. Then come back down and try to keep it tighter on the way down. Like that already looks better in her low back. So now it's like, okay, we found that this stance is better. And again, it's like a lot of people, and you can stop, just see that, you know, everyone's doing conventional deadlifting and they're like, that's what I'm going to do too. But maybe there's something going on here that you don't even know about, that when you go down there, it might not feel bad right there and then. Say 3 months down the road, you go reach for something or you go deadlift and then your back's like, that's not cool. Boom, something happens. That's where, you know, coaching comes into play to see those small things. And it's like, maybe we do an assessment. Maybe you go see Sarah and figure out why this is not functioning properly. And then now we have more pieces to the puzzle to figure out what's the best stance and approach to your deadlift.
Hey, that's a lot of things. You're close. Good. Toes. That's lower than my assessment was, by the way.
Which is not bad. Like, we can elevate it, but like right now, it's not too bad. But the one thing I'm kind of curious about is your low back in this position. But
I feel fine.
okay, so go for it. And then come back down, yeah. Keep going, do a couple more. Do you ever get low, like soreness in your back? And good. So this is a good example. Like, she looks in a good strong position, but like, do you get usually like sore like right here?
I do.
Yeah.
Yeah.
So she doesn't know how to use her hip for extension. She's using her lumbar spine for extension first and then the hips. So this is really common for like yogis or women who are really mobile and flexible. So one of our yoga instructors, Camila, right now is learning how to be a coach, and we went over the deadlift with her for about 3 hours. And I like right off the bat, because I knew she's really, really flexible. I'm like, do you get low back pain when you deadlift? She's like, every single time. So when I saw her deadlift, like she gets here and she's literally like this the entire time with her head up. And when she comes up, it's her low back first to extend and then her hips. So it might be just like cueing that I don't want you to extend through here, but more through the hips. Go again. And when you're driving up, like really, really, really squeeze on the bar because I want this to be locked. Yeah, like to the point where you break it, but don't break it. We need these.
Okay.
Yeah.
Do it, you know what I'm made of. So like squeeze it down.
Yeah, and get a little less arch there if you can, but keep your head down.
This way or this way?
The other way that you just did. Yeah, and try to keep tight. Take a deep breath in, hold it, and then drive up. That was better. So maybe her issue is actually learning how to turn on her core. Because a lot of times when people deadlift or just do an exercise where they have to think about it, they just don't breathe and they don't create intra-abdominal pressure. So this kind of goes back to point number 1, having a strong core. And having a strong core all starts from breathing, right? So when we get low back patients, a lot of times I'm teaching them how to breathe. So many of us kind of breathe through our chest, and we don't use our diaphragm. And when this starts working better, your hips get a little bit looser, and those hips kind of get that low back to kind of settle down. So when I think of powerlifting, those powerlifters, the reason why they don't have their discs like shooting across the floor when they deadlift is they know how to use their diaphragm and pelvic floor. And when you have these two working properly, they kind of compress it down into like, you know, your core muscles into this kind of canister. And a good example that I give people is like if you took a Coke can that's not open, you step on top of the Coke can with your whole body, it's not going anywhere. The moment you open it, boom, it just crushes down. So a lot of times like powerlifters will use the cue of get fat. So I want you to breathe in through here, hold that tension, and then drive up. If you can't keep that tension, weird stuff will happen. So like with you really quickly is like breathe in, hold, and then drive up. And like, yeah, so sometimes what I tell patients and clients to do is like, if you're at home and you can't fall asleep at night because you're like thinking a bunch of stuff and you're on your phone looking at Facebook, go one hand on your belly, one hand on your chest, and all you're going to do is breathe into your bottom hand. So you breathe in and then exhale without that top hand moving. But a lot of times people go and then back down. So it's all through here, and that's kind of the first step of learning how to breathe, and sometimes it's just that one thing. Cool? Any questions on breathing, core activation? No? Who wants to go next? Okay, let's do this thing. So let's bend your knees, like get into that position, yep. Squeeze tight. How does it feel being in this position? Okay. Okay, so what we can do, we can actually add another 45-pound plate because that makes it a little bit easier. Yeah, let's play around with that. Yep. So again, like if it's super painful, then we can, oh, thank you. We can also use a thinner bar with the fives. They just kind of drop it. And I see that with clients all the time. They're doing really well through all their reps. On their last one, they just, I'm done, right? So people just, I don't know why they do it. They just do it, right? So that's why creating tension, keeping that tension in your body the entire time is super important. Because when, you know, if I told you to pick up a 100-pound dumbbell, you wouldn't want to be like, okay, let's go pick it up now. You'd want to like brace yourself, squeeze it super tight, and then drive up, right? But for some reason, when we're deadlifting light, because I want to teach the pattern, they feel like they're able to just like, yeah, I'm done now. I can just throw it down. So that's why like even on your last rep when you're putting it down, it should still be perfect, just like if you're about to do another rep. And that's another good cue that I tell people is like some of the best powerlifters in the world that are really, really, really strong, they can learn the feedback that their body's giving them, that if they did one more rep, they would get injured, right? So if you listen to your body more of what's going on, you can have a higher chance of not injuring yourself. So like when I deadlift in my programming, I'm looking at how much sleep did I get and what's the quality of sleep, how's my stress been during the week, and how much volume have I done already for the week. And good. So couple things, kind of like Annie, when you came down, you're here. So if you can, think about almost finding neutral with your spine, and before you go, taking that deep breath in, hold it for a second, and then drive up. And then on your way down, same thing, try not to put it over your knees. Almost think of literally like sliding your hands down towards your knees. Better, yeah. And good. So that was better on the put down, but now what's happening is when you come down, you're doing this with your head. And that's a habit I see a lot with people is they're constantly doing this when they deadlift. This with their deadlift. So what happens in that position when you do this, now it's shortening up all this. So now you can't be elongated. Now if you do this, you also lose some power. There's some cool stuff that I've seen online where they do a quick assessment of someone lying on the ground face first, and they're just trying to drive their heel up into someone's hand. And with the face down, because now your spinal cord is nice and straight, they were able to resist against the person. Putting their head up and trying to do the same thing, they lost some power. So if you're thinking about, increasing your deadlift as you're getting stronger and you're constantly doing this, I would like to keep it packed down. But again, it also depends on the situation, right? If you were an Olympic weightlifter, yeah, they're here all the time. If you were, powerlifting, yeah, I would kind of want you to have a packed neck. And for the most part, general population people, like, you don't need to keep doing this. To go to, like, if someone's really like struggling with their deadlift, then maybe start there. And if it feels like way too easy, then it's like, okay, maybe let's go a little bit lower. But it's all trial and error, right? Whatever feels better, that's where you want to kind of go. But let's straighten this guy out. Do a couple more. Like, that looks pretty good to me. Like, how does it feel? Yeah.
It's been
And good.
it's been a very long time since I've done those.
Okay, perfect.
But
No pain, no nothing, no tingling, no. Yeah, so like,
all I've been doing is just a kettlebell, like a lighter kettlebell
yep.
from physio in Cairo, and I was even
Yeah.
struggling with that.
Yeah, so like a lot of times, that's where I start with clients. Is like after I teach them how to hinge with just their body, it's like, yeah, I'll go to a kettlebell. But sometimes, like, there's exception to the rules, right? So sometimes I like just going from here because maybe someone told me, like, I really want to learn how to barbell deadlift, and I'm not going to tell them no. Sometimes, like, the kettlebell, when I get them either from top down or top up, like, having them here, they can't, like, get to this. So it all depends on the person. But, like, to me, like, that looked really good. And, 65 pounds with,
That felt great, and
yeah.
I've been struggling with the 25-pound kettlebell.
Yeah.
So maybe
Yeah, like, totally. And, like, say this is where it comes back to, like, listening to your body. Say you did this for 1 week and it felt great, and the next week it's like it felt like complete garbage. Maybe elevating it one more time. Like, after like 3:45, it gets kind of tedious to keep like putting them back on. But using 2 plyo boxes, like the ones that actually have the inches written down, like the ones that we have, a 12-inch, 6-inch, or 18-inch, like just going from there and just learning how to hinge. So like one of my buddies who moved over to Hollywood to train a lot of Hollywood actors for films, he got to work with Bradley Cooper for American Sniper. And he had to put on like 60 pounds of muscle, and he wanted the guy to deadlift. And I remember him telling me that Bradley Cooper's toe touch was literally this. Like, you could not go any further. So he's like, how the hell am I going to get this guy deadlifting? So he used the trap bar, which is another option. And his trap bar deadlift was usually to here and back up. But he got Bradley going up to 600 pounds, and that's still a good, feedback and stress into the nervous system to get stronger and to build muscle. Like, there's no rule that you have to go off the ground. And a lot of people, when they see the deadlift online in the gyms, they're like, I have to go off the ground. But if you ask yourself, like, why do you want to go off the ground? You're just like, I don't know. The only reason why it's like this is that when weightlifting went into the Olympics, they had to figure out how much distance they need the bar from the ground, that if the lifter lost the barbell and came crashing down on them, how much clearance they need for their head not to get crushed in. So they measured people's heads, and on average, I think the bar from the ground is like 11 inches. So if you put your head underneath, you won't get crushed. And then they made sure that all the plates were in that diameter to have 11 inches off the ground. That's the only reason why. So elevating it, you're still going to get strong. You're still going to build resiliency. So why not, right? Any questions, thoughts, concerns so far? No? Does anybody else want to jump in that I haven't done? Yeah. Yes. What do you mean, like shorter this way? Again, it's like you don't have to do the full bar, right? Like, if you were Olympic weightlifting and powerlifting, I'd be like, no, you have to stick to the full bar. But if you want to just get stronger hamstrings and glutes and get strong in the deadlift, why not? right? Also, there are bars that are thinner because sometimes people have smaller hands, right? And again, it's like you don't have to conform to what the rules are. Like that's just like throwing a square peg in a round hole, like trying to like just get it in there, and it's not going to work. So there's no like, as a coach, I would not tell a client like, no, you're not using a short bar, right? But it's like, in my head, like if you wanted to challenge yourself down the road, because eventually you can't pack weight on the shorter bars because it's only so long. So you might hit a plateau, and then when you go move on to the longer bar, it might feel off, right? But if it's like for single leg deadlifts, why not? Right? And that's something else, is like sometimes with clients that just can't do the barbell deadlift and it's hurting their back and it's just getting really frustrating, I'll switch them to a single leg. And a lot of people can get that, and you get a little bit more bang for your buck. Because when you look at functional training, we are all creatures of one leg at a time. We're never like this, unless you're, I don't know, playing darts, right? Like, and every sport's always on one leg. So it's like, why not train like that too? Yeah, there's always options for people. You don't always have to conform to what you see. It's just learning what those things are. Yeah. Any injuries I should know about?
Well, like a year ago, I hurt my back deadlifting. So
Okay, this is going to be perfect. Okay. Don't be scared.
Okay. Yeah, I was with a trainer, and I was working out, I like did the kettlebells, and I worked up to a bar,
Mm-hmm.
and then one day, it was after like 4 or 5 months. And
Before you left it. So let's go feet closer. So this is another good point. When people are trying to deadlift, sometimes they go too wide. So if I asked you, I want you to jump as high as possible, would you want to do this? You'd get pretty close with your feet to jump up. So if you look at the deadlift as a power exercise, to generate more power, you want a smaller base of support to kind of get that. So sometimes just switching that will make a huge difference. But yeah, so that's a little bit better. Reach down and don't pull up just yet. There's a couple things I want to do. So head down, try to keep it neutral, and let's try to get this together a little bit more, yep. And then squeeze super tight like you want to break it, and then try to drive up. And then come back down, and then stop there. How did that feel?
better.
Okay, so like it's in your initial point of lifting, your position was like this, right? So you kind of want to have more of a neutral base with your spine and reaching down. But another thing I see a lot of times when people have a really good lift up on their way down, they'll sometimes kind of slide their legs forward and then come here, right? It's kind of, again, a weird habit that people do. It's this like kind of weird, I don't know, stanky leg thing. But again, this comes down to practice, right? Like if you, again, going back to that powerlifting analogy I always bring up, if you ask any powerlifter that's been doing it for decades, they'll tell you that their deadlift's not perfect, right? So if those people are saying that they can always improve, again, like for general population, like there's always ways to make it better and feel better and look better. But let's do a couple more. And same thing, like squeeze the bar super tight. Think of getting a deep breath in, keeping the head neutral, pushing the feet out, and then when you're ready, drive up. And then come back down nice and slow. Yeah, so that was a lot better already, right? So if someone's deadlifting on their own, they don't really have someone watching it, or you don't film yourself doing it, you don't know if you're doing it correctly. Now you're just building an old bad habit. So now every time you deadlift, it's just a little bit off. So it's like back pain doesn't happen like this. It's usually it led up to it. So a lot of times it's, you know, bending over to pick up your sock, bending over to pick up your kid with a rotation with bad form. And then you go to the gym and, you know, you've been deadlifting forever, but with kind of off form, it's kind of the straw that breaks the camel's back, right? So the more you can reinforce good patterns and good movement, then you kind of, again, bulletproof yourself to get better at it. But again, that was already better. Like, it's just a small little things. Yeah, so for you, it's like if you had your like camera, you'd be able to see it a little bit better, but it's just like if you're able to, again, engage the lats by pulling the bar towards you, that's why I want people to get it close towards them. And when you're pulling this can extend a little bit more, this can stay flat, and then again, when you're bending it in half, it's more lat engagement, pulling this out towards the side, deep breath in, hold tight, and then drive up, then you'd have a good deadlift. You can try it again if you like. Yeah. Yep, squeeze tight. And good. So that was already better. The one thing, if I had to be super picky, because I think it's because like your brain remembered that, you know, I hurt my back, that initial movement, you're kind of shifting forward because you don't know if it's okay, and then coming up. Like when you hurt your back doing the deadlift, at what point was it? Was it the lift off, like the first little bit?
Well, it hurt the next day.
Okay,
So,
was one of
yeah.
those. Yeah, so like it might just be one of those habits where like your back is trying to like protect you from injury again, but it's just like reinforcing that this pattern is safe again, doing it over and over and over again, and maybe just staying at this weight, and now like, you know, 2 months down the road, let's try adding a little bit more weight and going from there. Yeah.
Some of the deadlift aches and pains the next day, like it could be muscle as well, right? Like if
Yes. So on that, when I tell clients, is like if you're getting sore down here, we got a problem. If you're sore up here, like mid back, I'm okay with that, because a lot of times when everyone's been sitting like this all day and I'm asking you to extend your spine in perfect posture and hold the weight and be super tight, these are just turning on, and like those small little stabilizer muscles in your back are now, you know, getting a little bit stronger. So if you're getting sore up here, I'm not too worried about it. It's the moment it gets like down here and it's like deep and you're like, yeah, I did something wrong, then that's where it's like, okay, we need to reevaluate how we're deadlifting. I mean, yeah, let's do it. I already saw something interesting with his.
We only had 1 2 before, but
So let's move you a lot further forward. Keep going, keep going. Yeah, now reach down for it. Yeah, so before you go, if you guys can see it from the side view, like there's something here that I'm like, as a coach, I'm like, yeah, there's something going on there. So let's drive up and then come back down. How did it feel off of 3? How did it feel off of 345s instead of the 2? Yeah, like, again, if I had to be picky, there's something here that's kind of like stuck. And I've seen clients with like, my client Kim, kind of has that same like, so like jammed up. So when I train clients, I try to get their movement patterns to like improve. And one of the things I do is the camel movement, but one segment at a time. So our spine, with all the vertebrae that's kind of stacked on top, like every single one should have interdependency about 7 to 10 degrees. And then when I get them to think of like, I want you to unravel your spine like L5, L4, L3. And then some people will start here and they're like, boom. And it's like, well, what happened to all these? And sometimes people are trying to think about like unraveling their spine and they're just staying in that position. They're like, am I doing it? And I'm like, you're not even moving. So something like that, like a corrective exercise could help. It could be some other stuff. Like this is where a lot of times when clients think trainers are like gods of movement and rehab, but I always tell clients, I'm like, you know, maybe I can figure out what's going on, but I can like totally be wrong. And then you go to a physio in Cairo, they're like, oh, that guy's an idiot. So I always tell people, I'm like glorified like PE teacher, like to be honest, right? Like, yeah, sure, like I've been in the industry for a while and I can see patterns of people, but it's always easier just to go to like someone like Sarah and she'd be like, that's your issue. Boom, done.
I do have a this issue.
Okay.
what I see on him is that his body is protecting, like it's kind of in spasm. So like Raf said, I guarantee he has a lot of global movement through his spine, but no real specific individual movement through his low back. And that could just be his body protecting him from injuring his possibly already irritated disc. So whether or not we can like work on that for treatment or something like that, like again, it would be hard to know right now, but he needs some extension for sure. in his
Yeah.
back.
So in that case, would he know to do this exercise, or would you? Like,
So-
how do you know as a person doing exercise exercises, how do you know
So,
do that?
yep.
Right, and he says his back looks good.
Yeah, it feels good. It's actually, like, don't you have to infuse something and
Protein.
protein? So it used to be
We get it everywhere,
lots
Okay.
This is like 7, 8 years ago.
Okay. So like the one thing, like if I was training you as a client, I would actually move away from this for a while and go to single leg and see what happens. Because a lot of times when we go onto one leg and now we're working specific hip stabilizers, maybe something's going to open up and be like, hey, this feels better. Now I'm going to give you a little bit more freedom back here. And again, it's like a lot of people like this exercise over single leg stuff because it's more of a meathead exercise and it's easier. But when I get someone on one leg with weight coming down, like there's so much more that's happening. So you're like not only working your glute, your hamstring, your adductor, low back stability, like foot stability, ankle stability, there's so much more happening. And when you get really good at that, like things start just clearing up. So you can use dumbbells, kettlebells, barbell if you have really good balance. But it's like I'm more impressed with people who have more single leg strength than a heavy deadlift, because it's like I always ask people when they are married to an exercise, I'm like, why do you want to do that one? What's the purpose? If the purpose is to get strong glutes and hamstrings, there's like 80 different exercises to do that. But again, it's like it's more satisfying to see all the plates on the bar and throw that on Instagram and you get all these likes. But if you do a single leg, everyone's like, man, whatever. But most people struggle just standing on one foot. And now getting really good at that and adding load to it is a whole nother animal. And again, that's another way to bulletproof your body.
He's also a case where I would probably want to see clinically. I feel like, because I can tell he's hurting. Not just deadlift is good.
Yeah.
But I can, like, if I watch him move, I can kind of see his body, like, oh, he's careful, so just that's what I see.
All right. Any other questions people want to try? Yes. So whatever leg is coming back, I would have a contralateral load, so the hand holding, with a kettlebell, dumbbell. I like kettlebells more, only because like the ones that are good quality, they have a thicker handle. So now you're working grip strength a little bit more, and that will translate to this. Because a lot of times when people are trying to deadlift, they hit a plateau because they can't hold on anymore. And they end up kind of like losing their grip here. And when you lose tension, we're feeling it here, right? So single leg deadlifts might be a great way to, as a recovery, maybe for a phase or two, take away the barbell, go to single leg deadlifting. Yeah, so like the front leg would have a soft bend, and like the back leg can be straight, it can be bent, whatever feels more comfortable. As long as you're hinging at the hips and working glute hamstring, then by all means, yeah. Anyone else want to deadlift? Anyone else want to ask questions?
Can you show me how to do single? I can't balance.
Yeah, so when I train clients for single leg deadlifts, I go body weight first, because it's like, if you can't stand on one leg, why would we load it, right? So what I tell people to do is, like, I like to use hands as a counterbalance, is reaching out towards the front and coming back up. So a lot of people who've done yoga, they're like, oh, warrior 3, and they lock their knee out, but I want to have more bend so I can get my hamstring and glute firing. And a lot of times in yoga, if you already have low back stuff and you're locking out your knee, you're just jamming and pulling onto all the nerve endings that fall through that back of the knee. So if you have a lighter bend, you can get more glute and hamstring activation. So for someone like you, what I do is really easy. Maybe go with a longer one. So again, let's go right hand, left leg out. You're going to, as you're coming back, you're pushing the dowel out and back up. And again, this is another cue of getting lat engagement. Yep. And then back up. Like that looked really good. So I would do this first.
This leg is shaky.
Yeah, so again, that's like all that feedback, right? And you're working that hip. And again, like the knee joint, I call it the stupid joint because it doesn't have its mind of its own. It's like the hip and ankle are the ones that control this. So we're working both of those joints to keep that knee in line. And then when I look at this as like bulletproofing again, people, is that this will lower your risk of getting like, you know, meniscus tears, ACL tears, all that kind of crappy stuff that happens. But again, single leg strength and stability kind of trumps all. So on that side, I would have even a softer knee. Yep. All that shaking is honestly fine. You're not doing it wrong. If your knee was like that, then I'd be like, yeah, maybe let's do something else. But nice and slow, right? Again, just like how we did cars, if you went fast through it, you wouldn't get the benefit of it. Nice and slow will always work. Sometimes I like getting people barefoot, and that's another thing you can do in the deadlift is if you're barefoot, you get more feedback because our feet are like our hands, right? Our hands are exposed and we touch everything. But a lot of times, you know, with our feet, we're in socks and shoes all day, and now we don't have all that sensory information. So when I get someone barefoot, we're getting so much feedback, and all those nerve endings in the feet go right to our hips, and it's like, it's a train of communication. Now with socks and shoes, we eliminate that, and that's why a lot of people get flat-footed, collapsed arches, and all this other crap. And sometimes, like, with some of my clients who have really bad feet, I'm like, let's go barefoot for this 1 hour. And they get a lot more information, a lot more, you know, strength built just because they're barefoot and they're getting more info. Any other questions, thoughts? No? Everyone's kind of tired, I can tell.